So today we're going to talk about some myths that people have been holding very dear to themselves, and I want to bust some of them. So the first one is about root canal procedures being life-threatening. A root canal procedure is not life-threatening. It's actually tooth-saving. When you get a cavity that goes beyond the level of your enamel, it goes into your dentine and into your pulp, then we need to do something about that. We need to save that tooth. It is not risky to your life. We use good anesthetic agents. If you're allergic to some particular anesthetic agents, please be sure to tell your dentist before you start. And of course, obviously, go to a genuine, legitimate, certified dentist to do your work for you. Don't go to a quack. The second myth that I'm here to bust for you is that if you remove one tooth, you'll keep removing all your teeth. So I've had many patients who come and they tell me, oh, I don't want my tooth removed because if you remove this one, then the next one will come out, then the next one will come out. There's nothing like that. If you have cavities that are forming in your mouth, this is the same environment. So whatever you've been introducing in your mouth touches one tooth as well as the other. So the cavity formation process is probably similar in many of your teeth. So when one tooth presents and it presents more severely as compared to another one, then it means that there are others that are going to come. It's just a matter of time. So once that one is addressed, don't disappear from the dentist. Go back to another appointment so that the other teeth can be followed up. And then if you disappear, then after 6 months, another one comes, another one bothers you, and you have to go for probably some more extractions. And now you start saying that, one tooth led to everything coming out. It's not the case. Each tooth is individual. Let it be treated by itself. And just follow up on your treatments and have that completed. So myth number 3, braces can only be done on children. That's not true. Braces can be done on anybody who has healthy bones and healthy gums. Even if it's an adult, even if you're 70 years old or 80 years old, as long as you have a need and your teeth need to be realigned, your bones are healthy, your gums are healthy, then you go ahead and you do the procedure. And of course, that you can afford the procedure. The fourth myth is that using a certain type of toothpaste will stop your gums from bleeding. Teeth don't work like that. If you're getting bleeding from your gums, it could be from different sources. It could be that your gums are inflamed, so you have gum disease, gingivitis, or you have bone disease, underlying bone disease and gum disease, which is periodontitis. Or you could be having a tooth that is severely broken down and the gum around it is, it's affected, probably gets food packing there, and the vessels get swollen and engorged and the place keeps bleeding. So if those reasons are there, there's no amount of toothpaste that you can put on your teeth that will keep your teeth from bleeding. So please visit your dentist and have that sorted out. Remember, most of these things are marketing gimmicks. Another myth is that charcoal toothpaste is actually better than other types of toothpaste. That's not true. Toothpaste is toothpaste. We can tell you about herbal toothpaste. We can tell you about toothpaste that whitens your teeth. But honestly, toothpaste is just basically, the main component is just for cleaning your teeth. It has nothing to do with the whitening, because if you want to whiten your teeth, there's a certain product that we have to use, and it needs to be limited to the dental chair. It's not something that I'll give you to go home with it and use on your teeth, because it could have harmful effects. And you're not able to regulate because you're not a practitioner, you're not trained in this field to know that this much is too much for my teeth, or this is going to be ineffective because my teeth are different from someone else's teeth. The fifth myth I'm going to bust for you today is that brushing your teeth twice a day will keep you from getting cavities. Yes, we do tell you to brush twice a day, but have you considered the technique that you're using to brush? So if you go in and you're brushing your teeth like shoes and I'm done, that's round 1, and then you brush again and that's round 2. It doesn't work like that. Your technique really matters. Are you able to take your brush round? Are you able to access all the parts of your tooth that need cleaning, including the back of the last tooth? Are you able to clean the inner aspects, the flat surfaces? Do you clean your tongue? So all those things need to be considered. So don't go chiming that Terry said you have to brush twice a day. So you just go brushing anyhow. You have to brush and do the right technique. Myth number 5 is that brushing my teeth harder is better. No, it's not a competition. Okay, I know growing up, we used to compete with my bro, like who has the loudest when you're brushing. That doesn't work like that. It's not a competition. You brushing harder means your technique is definitely off. You trying to brush louder also means your technique is off. This is an intentional movement of your toothbrush. It's a deliberate motion, not a loud kind of shouting competition when you're brushing. So don't brush harder. Be gentle, but be deliberate with your strokes. Another myth to debunk is that chewing gum is a substitute to brushing. No, it's not. You and your funky breath will be busted. So, brush your teeth daily, twice a day, and use dental floss. There's no substitute for brushing and flossing. You can use your gum if you want to, probably a minty kind of taste. You can use mouthwash if you just want to, add a bit to your scent. I guess your oral hygiene. But that is not a substitute to brushing and using your dental floss. Those are just adjuncts. You can add them over and above your normal cleaning regime. And if you don't do them, it won't cost you, it won't harm your teeth. It won't cause you to get cavities or anything like that. Another myth amongst the chewing gum stories is that sugar-free chewing gum is good for your teeth. It's not. There's no additional benefit it gives your teeth. The only thing that it can do for you is increase your muscle power. So it's like gym for your cheeks. So if you want to, firm up your masseteric muscles, your zygomatic muscles, go ahead and chew gum, but it will not do anything extra for your teeth. The other myth that I would like to debunk today is that white teeth are better. I know it sounds racist, but white teeth are not better than other teeth. Teeth have different shades. We don't have, like orange teeth or pink teeth. Teeth are teeth. They all have shades of white. So there are people who have brighter shades and others who have darker shades. The same way you have people with fair complexion, others with dark complexion, others who are, somewhere in between. So there's nothing wrong with having darker teeth. It's only that it could mean that probably you had fluoride, a lot of fluoride in the water that you were taking when your teeth were forming, and that can be corrected, or that you're getting stains on your teeth. Now, the thing about the white, your teeth getting whiter, if let's say your teeth were a particular shade, and over time now you're seeing a line probably around your gum that is now getting brighter than the rest of your teeth, that should be a cause for alarm. Don't think that now your teeth are appreciating in shade, so things are getting better. No, it actually means that your enamel is burning. You're having a process called decalcification, and you need to get to your dentist so that they can help you arrest that and treat it. So another myth that we'd like to debunk is that an extraction is better than a root canal filling. Okay, granted there are opportunities where there are cases where an extraction will be the best option, but if your dentist has had a look at your tooth and has told you there's an option that we can save your tooth, we can do a root canal filling, then go ahead and have the root canal filling done. Why? Because there's nothing as good as a natural tooth set in bone. Once we do an extraction, you must consider that this tooth has to be replaced. One of the best replacements to put is an implant. And an implant does cost something. However, as good as an implant is, it cannot take the place of a natural tooth set in natural bone. So the best thing is for you to try as much as possible to save your natural tooth. If you remove a tooth that has been giving you a hard time, that's the end of the road for it. So this is only true for wisdom teeth, because those teeth don't need replacements. But for any other tooth in the middle of the sequence, once it comes out, it needs to be replaced. This is what happens if you don't replace a missing tooth that has been extracted. The opposing tooth, like in this case, you have the lower tooth that was taken out. So what happens is that the upper tooth that now doesn't have contact with the lower tooth keeps getting longer and longer because it's looking for opposition. It's looking for something to bite against, because teeth actually bite against each other. So if it doesn't get this opposition, it will keep drifting downwards to the point where this tooth will even contact your lower jaw. And by the time it gets to that point, then it's no longer functional tooth, and you will have to take it out. So yes, you had a problem on the lower jaw, so that tooth was taken out. But because you didn't bother to replace it, now the top tooth has to be taken out. So you're losing 2 for 1. So if at all the doctor tells you that this tooth can be saved, let's do a root canal filling, please go ahead and have it done. Because this will save not only that tooth, but even the tooth on the opposing jaw. Root canal treated teeth don't work. So that is a myth that exists because of this particular reason. Once a root filling is done, it has to be followed up by a crown. This is what a crown looks like. It's like a cap that's put on top of the tooth. Now, if the root canal filling was done and the crown was not placed within 3 to 6 months, then yes, it will break. But it doesn't break because the root canal filling has failed. It breaks because now there are so many heavy forces landing on the tooth, and the tooth is brittle. So it ends up snapping all the way into the root. A root treated tooth loses the natural moisture, the blood supply, because when you're doing a root canal filling, we are removing like the living component of the tooth inside the tooth, like inside the bone marrow of the tooth. That's what we're taking out, the living component. So when we leave it like that, it becomes brittle and weak. And it has to be protected by placing a crown. If we don't put a crown on that tooth, then all the forces that land on the tooth will be spread into the weak and brittle roots. And that's how it breaks off. Either the crown just chops off completely, or it splits all the way into the root, and you have two sliding planes. It gives you a lot of pain because now it's gliding against and pinching your gum in the middle. So if you want your root canal procedure to succeed, please have a crown placed on it. Don't have a root canal procedure done and you assume that now that tooth is sorted. You will not feel any pain from it once it's done well, but bear in mind that the tooth has to be crowned. In most cases, we do the crowning immediately after we finish the root canal filling. But if you have to give it a leeway, perhaps 3 months. Although if your tooth is severely broken down, like most of this crown structure is composed of the filling material, then you need the crown to be done almost immediately.